This is the new TC Pride Podcast, episode 99, on location at the Earle Brown Heritage Center for the 2018 Opportunity Conference. TC Pride Podcast on location of the 2018 Opportunity Conference, and I'm here with
Leah Yeomans, chair of Bisexual Organizing Project.
And we were talking before we started recording here. Bob has actually had a lot of visibility this year.
Yes, we have, and thanks to our partners at Twin Cities Pride, we have a large marching contingency in the Pride and a bi flag in the Color Guard. We've also been out to as many events as our volunteers can handle to bring out bi visibility.
And you mentioned the flag in the parade. This isn't just any flag.
No, this is huge. Huge flag.
I've heard it described as ginormous.
It is ginormous.
And how many people did it take to carry it last year?
At least 30.
And what's Bop up to at the conference today?
We're just here to be a part of Bi Visibility. March is actually Bi Health Awareness Month, and so we've been promoting a lot of resources for health.
And how can people support all the work that Bop is doing?
You can support us with your time by volunteering with our organization or donating money to our organization through PayPal, just by visiting our website. We also have a Bi Essentials program that helps fund us, and what that does is we go out to organizations and train them on being more bi inclusive. www.bisexualorganizingproject.org.
EJ Jack. I'm here with the University of Minnesota Health. So we have a booth here. We're supporting the Opportunity Conference. The University of Minnesota Health has just started a comprehensive gender care program. So we're getting the word out about our comprehensive gender care program, which provides gender care across the lifespan in various services. Sure. They can go to mhealth.org/gendercare, and our phone number is on there, and check us out.
Julie Jacobson.
And Julie, who are we with today?
The Minnesota Department of Human Services Alcohol and Drug Abuse Division.
That is a long name. Is there an acronym for that or something?
Well, absolutely. Minnesota DHS is Department of Human Services, and then we're known as ADAD.
And what's the organization up to at the conference today?
Well, we're here to provide information about our substance use disorder reform legislation and also on the opioid state targeted response to the opioid crisis. Grant information. We're also asking people to sign up for our Gov Delivery so they can be kept updated on the information that's coming out of our division that's related to substance use disorder reform, and also providing information on how to get updates from the mental health division.
And what's the state of the substance abuse disorder reform? Is that what you said?
Yes, that is what I said. So the legislation was passed in 2017, and it's going to go into effect on July 1st of this year. We're going to have a 2-year parallel process as we begin to integrate the new services for everything to fully go into effect by June 30th of 2020. So what we're doing currently is providing people with updates and announcements regarding the changes that are coming to the system, and we're encouraging everyone to subscribe for email updates through the public.govdelivery.com/MNDHS/subscriber/new. And this way you can stay updated on all of the current information that comes out of the Alcohol and Drug Abuse Division, which will connect you to the substance use disorder system with the state of Minnesota.
Denise McAlpin with New Way. So New Way serves adults with co-occurring disorders. We have an extended care residential program on First Avenue in the Whittier neighborhood for men and transgender individuals. And then our outpatient programs around the metro serve anyone. And we are methadone friendly and GLBTQ plus friendly. So today I actually had the privilege to speak on a panel about how to best serve GLBTQ plus clients in mainstream treatment. But I've been here for 2 days exhibiting with some of our program information and talking to folks and just doing some networking and seeing what else is going on in the Twin Cities. So we have a very robust alumni association. We have a Facebook page. Also, if you want more information about our programming, you could go to www.newway.org.
Raven Baker. I'm here with Prairie Care, and we offer services for mental health for children, adolescents, and adults. We offer care kind of at the whole spectrum of services, starting with inpatient hospitalization care for children, adolescents ages 6 through 17. Then we have a step-down program, a partial hospitalization program, which is for kids and adolescents ages 6 through 17 who may still be experiencing suicide ideation but are safe enough to go home at night. That really includes a whole team dynamic. So there's a social worker, a therapist, family therapy provided, along with a lot of process groups with other kids who are going through similar things. And then we also have a step down from that, which is our after school programs for kids and adolescents ages 6 through 17. We have our behavioral development program for 6 through 12-year-olds, and then our Healthy Emotions program ages 13 through 17. And then our other programs are really kind of more for adults. So we have IOPs that are specialized kind of at each different sites. We have 8 sites throughout the metro, and those sites have different services for adults, clinic services. We have psychiatry services along with therapy services, and then individualized IOPs, certain groups. So we have adapted DBT courses. We have a first psychosis program out at Edina. We have our new dual diagnosis program at our Brooklyn Park site. That is for ages 13 through 26. There is a medication-assisted therapy with that. So in individuals who need Suboxone, that is included in that if needed. We also have our transcranial magnetic stimulation therapy, which is out in Edina. That's for individuals who have medication-resistant depression. So they've tried 4 medications and they haven't proven to work. And this is a type of therapy. It's similar to stimulation such as ECT, if you're familiar with that, but way less invasive. So another solution to try and help individuals with depression. So we have a lot of different services, and we always have openings at different sites. The way to get involved with Prairie Care would be through our free needs assessments. Anyone can schedule a free needs assessment at Prairie Care and come in and meet with a counselor to basically get a level of care determined, and then a psychiatrist is involved in the recommendations for that planning. So we provide recommendations to Prairie Care, but also to other community organizations to find the most appropriate level of care, and that is completely free. So it's a good way to just kind of get started and get someone help when they need it. And the number that you would call for that is 889-Prairie, or you could go to prairie-care.com to kind of find out more about our programs and all of our different sites.
Hi, I'm David Lopez. I'm from Red Door Clinic. So the Red Door Clinic has been around for quite a while now, I think since 1971, but I'll have to fact check that. But yeah, we're in downtown Minneapolis, and we're a HIV and STD clinic. So what we do is testing for most STDs and HIV, and then we also have care linkage, we do PrEP, we do PEP, we also do birth control, and we also have partner services. So if anyone who tests positive for like gonorrhea, chlamydia, or syphilis, we help them tell their partners so that they can get tested and treated as well. So right now I'm just tabling, pretty much just talking about the services that we offer, handing out condoms and lube, and information about what Red Door is all about. reddoorclinic.org.
Marcia Berry. So I'm the Education Director for Training to Serve. We're the Minnesota-based organization that provides education and resources to support LGBT folks as they age. So we do education for all different kinds of programs and services around the state. And we have a lot of resources because we know that aging is an issue that's going to affect everybody, and we don't often think of it in the LGBT community. We have a conversation coming up. It's about LGBT folks and aging, and it will be April 25th, and Wilder is going to host it at their facility at University in Lexington.
What are some of the questions that people have for you when you talk to them at events like this?
Often they'll ask, well, why is it different for LGBT folks as they age? How's that different from the rest of the population? And we know that sort of long-term discrimination makes a difference in how people want to approach aging, how they want to approach especially aging providers and those aging services. We know it's hard for people who've been discriminated against to reach out to services as they need them. trainingtoserve.org. Check out our website.
Leon Flack with UCare. We are here just to provide information about our health coverage plans throughout Minnesota, and that includes primarily Medicaid and Medicare. We do have a commercial product called UCare Choices, which is available on the MNsure Exchange. Typically, I'll get questions that individuals have about the scope of coverage, how they become eligible for that, accessibility in terms of provider groups and who's in our network and who isn't. And we do cover basically any eligible provider throughout Minnesota for our healthcare coverage and network.
And there's a lot to know when it comes to healthcare coverage. I'm sure there's a lot more information online. Where can people go to find that?
They can find that at ucare.org.
Rachel Harrison, POR, Power of Relationships. We are a children's mental health agency. We provide targeted case management and CTSS life skills for youth residents of Hennepin County. We recently started an LGBTQ day treatment program at our Golden Valley location, and also offer a variety of different other outpatient therapy services such as play, art, EMDR, couples, individual, family. So we've been around for about 15 years and are really dedicated to helping families access children's mental health services. I've been lucky enough to be able to participate in a few of the informational sessions and trainings, and then again just here to really talk about our newly started LGBTQ day treatment program. It's pretty all-inclusive mental health and the LGBTQ community. And so at Power of Relationships, we're dedicated to that early intervention and making sure that families are aware of the services that are available for them to access. POR emotionalwellness.com, and we have a bunch of information, and all of our referral forms are there as well.
Krista Spielman, Community Relations Representative from Pride Institute. Pride Institute is a substance use treatment facility that works exclusively with the LGBTQ community. So all of our clients identify as LGBTQ, including individuals who identify as questioning. We have a residential treatment facility located in Eden Prairie, Minnesota. It's a 42-bed facility with medically monitored detox, so we have a 24-hour nursing staff. We have holistic wellness support, so we encourage clients to exercise twice daily. We have programming that's done specifically through an LGBTQ lens. We also have a PHP step-down program. So what that basically means is that individuals who live at our PHP house, which is located just a couple miles off of the residential campus, are shuttle bused to and from Pride Institute. So they engage in 8-hour programming throughout the day, but then at night they are kind of free to do what they want. So that gives them the stability of programming, but then the freedom to kind of experience life on their own. They just have to check in by 11 o'clock at night, and then we'll pick them up the next morning and bring them back to programming. We also have our outpatient locations. So currently we have an outpatient location in Minneapolis, and we are going to be opening an outpatient location in Rochester soon, an intensive outpatient location. So what that will be entailing will be flexible scheduling, and also a relapse prevention groups, Al-Anon support groups. And something important to know about Pride is that we work with individuals who are ages 18 and up. And we also have something that's very specific to us, which is a sexual health program, which is a one-of-a-kind program. It's sex and relationship affirming and individualized and value-based, and it's the only one in the nation. And it's something that a lot of our clients deal with is sexual addiction, sexual compulsivity, porn addiction, sexual anorexia. So that's something that's really unique to our program. Pride has been around for 30 years. Came about as a kind of response to the AIDS epidemic and has been evolving ever since.
And what are maybe one or two things you'd like people to know about the way mental illness affects the LGBTQ community?
I think substance use and mental illness are oftentimes comorbid and go hand in hand and can come from a lot of discrimination and oppression, not only from other people, but also internalized oppression and internalized homophobia and internalized transphobia. And so oftentimes what we're looking at is a systemic and societal issue. It's not the individual that's the problem. It's really cis-sexism that's the problem. It's heterosexism that's the problem that can lead individuals to having issues with substance use and mental health.
And where can people find out more about the organization and support the work you're doing online?
Pride-institute.com. Also, our 800 number is 800-547-7433, but the best place to go would be pride-institute.com. It's a newly updated website. We've got great resources on there. You can take a visual tour of Pride Institute, and there's also a video on there as well.
Bruce Ballinger, General Manager of Earle Brown Heritage Center. Yes, the Earle Brown Heritage Center is where Earle Brown actually was the original homestead. He inherited it from his grandfather. And now then the City of Brooklyn Center actually purchased it from the University of Minnesota and turned it into an event center. Earle Brown was what they call a gentleman farmer, but he also ran for governor. He started the State Highway Patrol, which is his real claim to fame. And he owned most of Brooklyn Center, actually, between logging and sheep farming, and even started the airport out here for training fire pilots for World War I think it was. Well, we are as big as we can get because we're a historical site, so we can't add more buildings. But, we constantly are trying to keep it up to date and up to the latest technology. So we spend about $300,000, $400,000 a year updating it every year. So.
And where can people find out more about the event center online and book an event? Yeah,
they can go to earlebrown.com, all lowercase, all one word.
Antonia Wilcoxon. I work for the Minnesota Department of Human Services as its Community Relations Director, which means working on inequities issues and trying to learn as much as I can about communities experiencing inequities so that I can bring that knowledge into our agency so that we are more responsive on policy and programs that we develop. I love this conference. I came last year and it blew me away because I was just not well versed on the subject, even though I had worked years ago for a nonprofit community-based organization serving young people who experience homelessness. And many of them were experiencing homelessness because when they came out, their families rejected them. But then I deepened my knowledge when I was here last year. So I came back and I have 2 staff here from my division so that we can bring this knowledge back. Very important.
Twin Cities Pride podcast on location at the 2018 Opportunity Conference. And I'm here with
John Parker Derbahosian.
John, good to see you. You were actually on the podcast last year when we covered Rainbow Health Initiative. How you been?
I am good. I'm excited to be here again.
Well, I'm excited to have you. For folks that aren't familiar with the Opportunity Conference, this is the second one. Tell people a little about the conference.
So the Opportunity Conference is, I would say, the Midwest or the Heartland, if you will, largest LGBTQ health equity conference. And what's unique about this particular conference is that we try to bring together providers, policymakers, and administrators all together for 2 days to talk about how we're going to address health equity for LGBTQ communities.
And what kind of things have been talked about at this conference?
Oh, goodness. I mean, a variety of perspectives. So we've had latest data and research that's been published in the intervening 12 months from our last Opportunity Conference. And we were able to actually premiere our new research that we've conducted, our Voices of Health data for the first time. We released it at our conference. And then we got to have a lot of conversations. I mean, there's been really great workshops looking at how do we look at the intersection of treating LGBTQ youth or LGBTQ elders or older adults? How do we look at the intersections, particularly of how sexual orientation and gender identity intersect with race and ethnicity, and how can we address both racial equity and LGBTQ health equity? So there's been a variety of topics looking at a variety of intersections, which has been a new theme for this particular conference.
And so I understand there's an official announcement coming up soon, but the cat's kind of out of the bag. Everybody kind of knows at this point. There's some big things on the horizon here for Rainbow Health Initiative.
Yes, there are. There are. So I guess the cat is out of the bag. It was in our conference program. So Rainbow Health Initiative has merged with the Minnesota AIDS Project. And our new name and brand is going to be Just Us Health.
Love the name, by the way.
Do you really?
That's very cool.
Oh, good.
Yeah. So for people listening, right, it's just us, right? So like justice, right? But just us.
Yes. So it's spelled like just us, one word. But the play is supposed to be on justice. Yeah.
And tell me a little bit more about what this new organization will look like.
Oh goodness! So all of the services, direct services that we've all come to expect and appreciate from the Minnesota AIDS Project will continue on and expand. We're opening a new behavioral health clinic that is going to really zero in on providing direct support services to LGBTQ communities, and then all of that great research and education that everyone has come to know and expect and hope from RHI will continue on in the new organization.
So like an all new super org.
That's the plan.
I love it. Well, hey, thank you so much for your time. Congratulations on all the great work with the conference, and I'm sure we'll talk to you again.
Great, thank you.
Jonathan Lassiter.
And you are one of our speakers today.
Yes, I am. I am the lunchtime speaker, and I'll be speaking about Black LGBT health, resistance, resilience, and risk. The talk is in basically 3 parts, and I'm really the first part I'm setting the stage about what we know about Black LGBT health currently on a national level. And then we'll talk about some of the pitfalls that contributes to our lack of knowledge around Black LGBT health. And then we'll go into a discussion of exactly what we can do to move the research and the practice forward for Black LGBT patients.
And where can people find out more about the topics that you'll be talking about today?
So, shameless plug. I was lucky enough to co-edit a book with my co-editor, Dr. Dolores Follins. And the book is titled Black LGBT Health, The Intersection of Race, Gender, and Sexual Orientation. It was published by Lexington Books. And last year it won the Gay and Lesbian Medical Association's Achievement Award. So you can find that book online. You go on Amazon. You can also find it on the Lexington Books website. So you can go there, and it's the first text to focus solely on Black LGBT health in the United States. You can find out about me on my website, www.jonathanmlaster.com. I'll spell that for you. It's JONATHANM as in Matthew, LASSITER.com.
Thanks so much for your time. Thanks for being here, and good luck with everything you're doing.
All right, thank you so much, Ryan.
Joanne Usher. So I have formerly been the executive director for Rainbow Health Initiative, and Rainbow Health Initiative planned the first Opportunity Conference in 2017. And now Rainbow Health Initiative has merged with the Minnesota AIDS Project, and we are Just Us Health.
And what can you tell me about this new we're calling it a new super org. What can you tell me about this new super organization?
So we see it as a really great opportunity to integrate and lift up the health disparities in the LGBTQ community, which has huge intersections, as you can imagine, with HIV folk. And the Minnesota AIDS Project has had wonderful services available for people who have HIV or at risk for HIV. And now we know from our data that our communities need the same kind of assistance. And so we're going to be able to offer those services to LGBTQ folk in addition to HIV folk. And besides that, we have opened a new behavioral health clinic in St. Paul, and really excited about our ability to address the significant health disparities around mental health illness issues for the LGBTQ communities. Well, our website's not up yet, so but if you go to either rainbowhealth.org or minnesotaaidsproject.org, that will have information about our new organization, about the merger. And we'll be having a grand opening name launch on April 30th at the new Behavioral Health Clinic in St. Paul. So watch for an invitation. Come and check us out. See our new logo. We haven't even launched our new logo yet.
So this is brand new.
Doug Melro.
Doug, great to see you again. How you doing?
I'm doing great.
Tell me about this conference.
It's been a fabulous event. Learning a lot, things that I thought I knew, but once I get in there and start learning some real statistics and facts, I realize that I don't know everything, but no one ever does.
And I understand there's an official announcement coming, but the cat's kind of out of the bag. Tell me about this new merger everybody's so excited about.
Yes, I'm very excited the fact that Minnesota AIDS Project and Rainbow Health Initiative are merging. We are coming together to become one entity, and it's a new entity called Just Us Health. We are also opening a behavioral health clinic and expanding a lot of our services and stuff in order to serve our community a little bit more.
Thank you so much for your time. Great to see you again. Good luck with everything you're doing.
Thank you for being here.
Carrie Link. I came because I work at Smiley's Clinic in Minneapolis, and I take care of a large population of trans and gender nonconforming patients. We're part of the University of Minnesota and M Health. We're a primary care clinic in South Minneapolis and affiliated with the university.
So I noticed your T-shirt, and you mentioned that you're a big fan of HRC. Tell me a little about your T-shirt. I haven't seen this one before.
I actually got this T-shirt at Pride couple of years ago, and it's one of my favorites. It's the black one with the rainbow colors across in little boxes, except one of the boxes is the HRC symbol.
And so what else, what have you learned about at the conference today?
I learned about documentation of sexual orientation and gender identity in our electronic health systems. It is really complicated. Collecting the information is only one part of the problem. Storing it and securing it for patients' confidentiality is another part.
Ryan Bortz.
And Ryan, you have a certain distinction here at the conference today. What is that?
I believe I am the only pharmacist in attendance at the conference.
And what's the conference like from that perspective?
It's really interesting. A lot of it's focused on medical intake and therapy, addiction things. So more of, I guess, the practice of medicine side. But it's really given me a lot of ideas about, okay, how could pharmacy, modify our systems to be more inclusive, and what types of things that are missing from the pharmacy curriculum, from training pharmacists, from continuing education for pharmacists, things of that nature.
And we've actually spoken with RHI before. There are actually a lot of areas where there could be a lot more education done.
Yeah, absolutely. In terms of pharmacy education, I'm not aware of any programs that really spend more than, maybe a day, one class, talking about health issues specific to the LGBTQ population. I really am encouraged by all the work that people are doing, and it's not exclusively LGBTQ people here. I have seen a lot of cisgender, straight folks who are here who are really committed to doing well by the community and really committed to creating inclusive environments that meet the LGBTQ population's needs. And it's been really great to see what's going on in the state of Minnesota.
And that's what it takes, isn't it? Everybody working together.
Absolutely.
Marilyn Fairchild. I work for the University of Minnesota. I'm a speech pathologist, so I work with voice clients, and the conference has given me the opportunity to see how all the other aspects of healthcare are addressing competency issues with LGBTQ populations.
And how do you feel about the conference overall?
I think it's been fantastic. It's been a great opportunity to dialogue and meet with people and learn new things. It's just been great.
E.G. Nelson. I am here representing the Center for Prevention at Blue Cross and Blue Shield of Minnesota. Well, so far I have been learning about how organizations are trying to make institutional changes that are more inclusive or responsive to LGBT health experience. So that's been very interesting. I feel great about the conference. There are a lot of different organizations represented, representing all different kinds of medical perspectives. So it's been interesting to see kind of a overarching representation of healthcare.
Alvin Lore Kame. I'm here to represent the Minnesota Department of Health, and I'm the statewide HIV strategy coordinator. First of all, I have to say that this is a well-organized conference representing people from all parts of the state. And we learn more about the issue that the LGBTQ community is are facing, and especially the transgender. This is a growing issue, and I was really impressed on how the diversity of presenters and topics. One issue that is really dear to my heart is like housing with the youth. So I learned a lot, and I was kind of like tracking all those presentations around housing. This is my second year attending. So I'm very impressed by the level of the quality, the services, and it's a well-attended conference, overall, more than 200 people, so that's great.
TC Pride Podcast on location at the 2018 Opportunity Conference, and I'm here with
Dylan Flunker.
Dylan, how you doing?
I'm good, how are you?
Good, and remind folks what your role is within the organization here.
Yeah, I am the Research and Policy Manager at the, newly merged Just Us Health. I had been with RHI beforehand, but now Just Us Health.
And we'll remind folks, you actually do a lot of the number crunching for the organization.
I do. I am the person that takes all of the Voices of Health surveys that people fill out at Pride or online and make the magic of numbers happen to really get a glimpse at what's happening in LGBTQ communities around health experiences and access across the state.
And so this is the second Opportunity Conference. Tell me a little about this one.
We were really excited to be able to conduct the conference again. I think last year we had a lot of great responses from healthcare providers across the state and also other health and human services providers, and there is a need to kind of come together and talk about what's going on with LGBTQ health access on a provider level, on a policy level, and on a systems change level. And so it's great to be able to have the opportunity to continue the discussion we started last year and everyone's kind of commitment to increasing health access and experience for LGBTQ folks across the state.
Well, hey, thanks so much for your time and good luck with everything you're doing.
Thank you.
The TC Pride Podcast is a production of Podletter Media and Twin Cities Pride. Subscribe now on iTunes, on Android, or by email at tcpridepodcast.org. Get above the noise by raising your voice. Podletter Media turns your email newsletter, blog, or video content into a more powerful, more personal, more intimate, on-demand listening experience. Your podcast, your story, your voice. Simplified, amplified. Learn more now at podletter.com.